Okay, come back. Once more round. Yes, come back. Okay, so limping is there. Where is the pain?
Right leg, sir. As of now, I'm having pain in the right leg.
Right leg. Okay.
From back and some pain here also.
Okay. And in the left, is there any
I
pain?
don't have any pain on the left, only right.
Only in the right. You don't have any pain in the left. Okay. From how much duration you have having pain? From how many days or how many months?
Like from April 2021.
From the April 2021, you are feeling pain. Okay.
Feeling pain.
So are you following my exercise?
Sir, like for now, I'm not aware of the exercise.
Okay.
So I just come today. So I will be following the exercise from today.
Okay. So let's see how much benefit you get after 7 days. Okay. ठीक है, आ जाओ. ठीक है, वेरी गुड. एक राउंड और. बस आ जाओ. तो कैसा फील कर रहे हैं पहले से अभी? हाउ आर यू फीलिंग राइट नाउ?
Sir, I'm feeling very great actually.
ओके.
And there are many improvements.
लाइक.
Yeah. So previously I used to have heavy pain in knees
Okay.
and at the back. Now due to cupping, blood cupping, those are decreased.
Those are reduced. Okay.
And I'm not limping right now. Small, some pains are there, but those are good.
Sometimes
Some pains were there, but not much.
not much.
Not much.
So as compared to the previous, how much relief? As suppose if I am asking about the percent, how much percent you are getting relief?
Sir, I can say 30 to 40, but to be confirmed 30%, I'm happy.
30% you are comfortable.
Yeah.
Okay. Previously, where you have pain? Where you are having pain?
Previously, I used to have pains in these knees,
This
here,
side. Okay.
and backside.
And backside. Okay. Backside. So, okay.
Now I'm walking bit freely, and everything is good right now.
Okay. That's fine. Yes. Come back. One more round. No limping is there. Perfect walk. Yes. Very good. Very good. So, how are you feeling right now?
I'm feeling very great, sir.
Very great. And what about the pain?
Pain I'll get sometimes, but only in hips.
Okay.
When I walk more.
Okay, when you walk more. So, quite better right now as
Yeah.
compared to the previous condition? Okay.
Compared to previous sitting, I was very better now.
Okay. What about the night pain?
Night pain.
Night pain during
Night-
sleeping. Is
No,
there
no,
any pain?
there won't be any pain. But when I try to sit or stand, I
Okay.
will take some support because in
Okay.
it will be some kind of pain.
That's a very good habit. You have to take the support properly while sitting and while standing from the chair and everything. So, how much percentage you have get relief?
60%.
60% relief.
Okay.
Okay, that's fine. So happy?
Thank you. Happy, very happy.
Yeah. Hello friends and welcome to all of you. Myself Dr. Vijay Prakash from Saubhag Ayurveda, Chardanagar, Kanpur, Senior Resident Doctor at Saubhag Ayurveda, specialist in AVN and स्पाइन एंड जॉइंट रिलेटेड प्रॉब्लम्स. तो फ्रेंड्स, एवीएन की सीरीज़ में आज हमारे पास एक पेशेंट है, मिस्टर प्रणय. ही इज़ फ्रॉम हैदराबाद. ओके, एंड ही इज़ कंफर्टेबल इन इंग्लिश, सो ही विल स्पीक इंग्लिश एंड गिव हिज इंटरव्यू इन इंग्लिश. सो मिस्टर प्रणय, टेल मी डिटेल अबाउट हाउ यू गेट द एवीएन एंड हाउ लॉन्ग एंड where you go for your treatment and now how you can come to me.
Hello all. So firstly I would like to thank Vijay Prakash sir for treating us in this good way, and whatever the treatment which was given, like I can see the results from my end. So coming to my AVN, actually in the past year, so due to corona, like I was given some steroids. So I was affected with this AVN. Initially I was not known about AVN, so gradually the pain got increased, so I went for an MRI. So it was diagnosed as a third stage. So recently, I came to know about Saubhagya Ayurveda. So I came for my first sitting in November, and I have completed my first sitting. And I was using the medicines from Vijay Prakash sir, and it's been 3 months. And now I came for second sitting. So previously in my first sitting, I used to limp a bit. I mean, I used to walk bit limping, so with limping actually. But now there is no limping as per my thoughts. And during this period, I also did some mistakes from my end, as it is new to me. Doctor used to suggest me all the time to do exercise and raw diet, but as we people work in different areas, so we will not get that much time actually. So I did a mistake sometimes, not regularly, but sometimes I skipped my exercise, and coming to my raw diet, I also skipped that sometimes. So these are the two mistakes I have done. So what I am thinking is, if whatever the doctor suggested us, if we follow through and if we go through all the things, then definitely we can see the results. And also now I can see my results in my x-rays also. But if I have done that good, following all the precautions strictly, then I could say I would be more better than previous. So what I'm thinking right now is, after this second sitting, I would like to take the be in all the precautions. I'll follow all the proper precautions, and then I'll go forward.
So how much relief you have got in the second sitting?
So initially in the first sitting I got 40% relief, and in between when I was at my home, so I was feeling some pain in my hips when I'm trying to sit and stand, and also at some night times. And recently it was winter, right? So there were more due to rain and heavy coolness. There were more pains, but not that much. Not initially. After second sitting, I would say 60%. 60%.
Okay.
Yeah.
That's fine. So, what would you like to advise to the people who are suffering from AVN due to the corona or any other reason, or due to the heavy steroid intake?
Yeah. So initially, we should not be in panic state. Actually, we need to think wisely, and we need to check through all the routes. Not only going for the surgery, in initial at the smaller age, it's not good to go through surgery. So first we need to check all the routes, what are the possible ways we can cure this AVN. So in the same way, I got your contact number, so I came here without any panic, and now I'm doing good. So I would request everyone whoever's watching this video, I would suggest them to try this at least, so that they will feel the better.